Welcome back. We are having our first conversation for the morning, and it's all about NHI and the services that they offer to Southside Belize City.
Across the country.
Across the country as well. But we are joined by Dr. Reina Cuellar, and she is the doctor in charge over at the Belize Medical Associates Southside Clinic, as well as Natalia Castillo-Rodriguez, and she is the general manager at the National Health Insurance, NHI. Good morning, ladies.
Good morning.
Good morning. Good morning. I just want to say I'm the health services manager.
Okay.
No
All right.
problem.
Well, thank you very much for that
Yeah.
correction, Ms. Natalia. Let's start with the role of the National Health Insurance, also known as NHI.
National Health Insurance, it's a government program. It's government funded for the last, we've existed for 22 years. We celebrate our 22nd birthday here in July that just went really, so we've been around for a long time. Initially, we started out in Southside Belize City. That was 22 years ago. In 2006, we expanded to the southern region, and around probably about 2016, around there, we expanded to the Corozal district. Come last month, we have now launched the NHI expansion for the Orange Walk district. And it's important for us to mention, because when people say NHI, they consider us a hospital, a clinic, and that is not so. NHI is a purchaser of primary health services for our population. So in the case of, I'm glad that Dr. Reina is here today, because we have several primary care providers on the south side, as well as support services, which include pharmacies, lab, and imaging. So we contract services from these providers. So we purchase services, they are the providers.
Right.
The contracts hold them to quality standards. So the quality standards are set by the Ministry of Health. So what we do by that contractual agreement is that we hold them to compliance and quality standards. So that is so important to understand. Another thing is the funding. Up to 2008, it was funded by the Social Security Board. As of 2008, the administration that came in, they made policy changes where it then became funded by general revenue from government of Belize. So, however, by legislation, we are a part of the Social Security Board Act. So they are responsible for our administration. So it's complicated because NHI with SSB, then people consider us providers. So yes, by law, we are administrated by SSB. They administrate the NHI fund, which is a separate fund from SSB. And then we are purchasers of health services. So we purchase from providers like BMA, Belize Healthcare Partners, Belize Family Life Association, Mercy right across the street, which is a geriatric model and quite comprehensive geriatric model that we hope to replicate in the north now that we go north, and the Matron Roberts. So and in Belize City, it's a mixed model, which has worked very well for us because it's private sector, NGOs like BFLA, faith-based like Mercy, and of course Ministry of Health, Matron Roberts. So that model over the years has proven to be the best model. When we went south initially, there was not private sector presence in the south. So we purchased solely from the Ministry of Health facilities. Over the years, we've been able to incorporate private sector in support services. In Corozal, there is Presbyterian, which is a faith-based as well, and there is also the Shanush Clinic, which is a private facility as well. So the mixed model has proven to be the best model. So going to Orange Walk, that is the model we're using, a model very similar to the Belize City model. And also looking at replicating the geriatric care model.
Yeah. I think where people get confused is in the wording, because you'll hear this is NHI facility or provider, and then you think, all right, so if this is an NHI provider, that's an NHI provider, then NHI must own these things, or this is for NHI, right?
No, no.
But it's also, I appreciate the clarification there, and what I'm understanding is that it's simply like, if I want to provide grocery bags, for example, for a large group of people, but I don't want to but I'm not the supplier of groceries. There's a supplier of groceries out there that I go to, and I come into an agreement with that grocery, and I say, hey, this is the agreement we'll have, and you'll supply, and we'll take care of what needs to be taken care of. Just as a simplified example.
And also you say in the grocery bag, I want flour, rice, and sugar.
Right.
And then I come back and make sure you're giving
Flour,
good
flour,
good rice, and good sugar.
Now getting to the good flour, good rice, and good sugar. Dr. Cuellar, correct? Dr. Cuellar, let's talk a bit about the experience at the BMA Southside Clinic in terms of providing NHI services, and what that has meant for the community and residents in the Southside.
BMA Southside Clinic is actually dear to my heart. I actually grew up in that neighborhood.
Oh, really?
So I actually surprise patients when they see me. They're like, you're the little girl that walked down the street. Yeah, like, you're from Tanuma Street. I remember you.
Yeah, wow.
I mean, to reach this far and to be treating the same people from your neighborhood is a
That's
great
amazing.
experience. I mean, and we established a good rapport. It's easy for them to relate to me, so that helps a lot. NHI becomes almost like a family doctor approach. You're there, yes, the concept of a clinic is still there. Is there an emergency, they get priority. However, there are appointments. We do have prenatals, we do have immunizations, we offer services for hypertensive and diabetics. So it's wide range. There's a wide population. However, at our clinic, we tend to have a higher population over 60. So we deal with a lot of chronic illnesses. We deal with a lot of hypertension and diabetes. So it's excellent, because what you're trying to gear of and what you're trying to do is educate these patients in order to prevent complications. As we all know, diabetes comes with a wide range of complications. And if we can prevent them to get to that level, to have them be controlled with just basic meds that are readily available, that's rewarding. That's rewarding. And I've been there for 10 years now, and I've seen that. We've seen that. I have new general practitioners there that are like 3 to 5 years, and they're like, Doctor, what we've accomplished with these patients is amazing, because we're not seeing patients with diabetic retinopathy, blindness, being amputated, as you were seeing before in the hospital sector. So that to get that level of primary care and level of education to patients at that level is great, because we're preventing complications and we're preventing people from reaching the hospital sector.
Yeah.
NHI is also rewarding because it's a program it has protocols, it has guidelines, it's easy to follow. It also holds you to quality. You're audited based on what you document on your file. So it's not just me seeing Paul and going, okay, Paul, go.
Right.
Yeah.
It's like, okay, Paul, we got to look at this. At this age, these are the things that could be a possibility. We need to get these testing done. Am I meeting those requirements? Am I giving Paul the proper care for his age range? Because we are assessed as that as well. So it's not just simply showing up and going just in vain, back pain, roll out.
Yeah.
So and it's for females especially as well, addressing pap smear, preventing cervical cancer. So it's not just sitting there and just handing out meds. It comes with certain guidelines to ensure that the patient gets a full package.
Right, because you could be tempted to shortcut the process, not seeing the program as important or the individual as important, because you could run the risk of categorizing them as being a part of this program and not necessarily quality customers within the private system.
Yeah. And then in that vein, then, let's talk about the affordability of this program.
It is.
All right. So when we contract for a population. In the past, in Belize City, it was a population of 12,000 for each primary care provider. 2 years ago, that was expanded to 16,000. So those people who have not registered, we encourage them to register.
That's in Belize City.
In Belize City,
BMA
Southside.
has space. BMA has
Yes.
space. We're trying to get more patients to come in and register. It's a great program. And all they need is a social security card.
The thing is, by contract now, it's called a per member per month payment. So for each member you register, we pay you. So so this is why too, the more members they have registered, their payment will increase, right?
And the services.
And the services as well. So the other thing is though that we have key performance indicators that we set for these primary care providers. So we will say that we will come in and do clinical audits. Actually, we're the only institution that does clinical audits of hypertension and diabetes, all right? So we have clinical auditors who will go in and actually do those audits, those medical records. Once they pass, that goes towards their key performance indicator pass, and they get a bonus. So every year, it's an inclusive process. We sit with them and we define country priorities, right? So NCDs, early booking is one, you know, and so we define these key performance indicators. We agree on targets and we set them, and then they work towards achieving
And
those.
these are independent auditors.
Yes, these are clinical auditors.
I also want to ask about the details of auditing. How do you audit in the medical field to make sure that you're giving out the best service?
It starts with protocols.
Okay.
Then you define a audit tool. Then and all of this is a process over the years, over 22 years, because when NHI started, we started at scratch, right? Protocols are then implemented. And then they have in-house checks they have to do with the head doctor. She has to pull files every month and check to make sure, using that same audit tool, that her team of doctors are complying to protocol. So when at the end of the year, when we bring in the clinical auditor, a clinical auditor would be a diabetologist like Dr. Eric Bradley. We would then bring him in as a clinical, and a team of internists along with him. We use Dr. De Paz. In the past, we had used Dr. Hidalgo, Dr. Arriaga. So what happens is they will then go in and do that. We have now moved on to a software that now captures an electronic record. And basically this year we're looking at documentation that is complete. And then next year will be the management, because it's new. We're transitioning from hard copies into an electronic record. This will also facilitate the labs and the imaging providers of uploading their results. So that will facilitate their work. So that will be uploaded into that system. So when they pull that e-record, it's there.
So
I wanted to ask Sab, if you'd allow me, to get an idea. I'd like to get an idea of the range of services that an individual can access under NHI. If I go to BMA Southside Clinic, can I ask for anything? And do I get any and everything?
And
because I'm sure people will come.
Exactly, as with any service. NHI is a great package. The logistics of the labs, the imaging, the package that is available from ultrasounds to x-rays. No, there's no CT scan. No, there's no endoscopy or colonoscopy, because I've had those questions. But from ultrasounds to all x-rays. And labs include a full range of labs, from certain STDs to your cholesterol, liver functions, So it's a full package.
Yeah.
But this is the beauty of guidelines and protocols, because I will meet patients like that. Patients will come in and say, okay, I cover everything you got.
Yeah, just give me everything.
Just give me. I belong to NHI. Give me. And I'm like, breaks. Let's see your age. Let's go through your vitals.
Yeah.
Let's see your weight.
Okay.
Let's go through your family history. Let's see what's essential. And the beauty of the electrical medical record, even when you had the file, is that you could flip back and say, well, sir, you had labs just done like 2 years ago. So far, you've been doing well. So it's not just saying, yes, I can. It's like, okay, there's guidelines to it. And that helps us because we all work with a budget as well. And I have to think about my whole population. If I give Paul everything, then when you come and be like, guess what?
Take why me forget.
Yeah, and I mean, we have a culture like that. When we have a culture like that, it's as a doctor, you have to know how to approach, how to explain. And healthcare is not just giving and ordering. A checkup doesn't just include doing blood tests. A checkup is addressing what's going on with your health, what's happening at home. It entails it's holistic. It's not just doing a blood test.
With a population of 16,000 that you guys are trying to reach, what is the staffing like?
Well, there are 4 doctors, 4 general practitioners. So ideally, I think we're looking at it used to be 4,000 per doctor.
Yes.
Yeah.
No, I would
There's
imagine.
a ratio.
Right, I was just going to say.
4,000 to one doctor,
Yeah.
3,000 to one nurse.
Yeah.
Okay.
Okay,
that's a
4,000 to one doctor, 3,000 to
Yes.
one
It doesn't necessarily mean that that's set off as your cutoff. I mean, if they say, I just give you 4,000, you look at that population. It depends on the day to day.
Yeah.
We aim at least to give, I think at my clinic, we've done certain evaluations, like the longest waiting time is 2 hours on a bad day. Okay, so it's free flowing with 4 doctors. And we try to ensure that we get at least 3 to 4 patients within an hour, depending on, of course, the type of patient that you're dealing with, because each patient is different. There might be a patient that may require more time.
Yeah.
And that's where staffing comes in, where you're, okay, I need to communicate with my clerk, I need to sit a little bit longer with this patient. Please make sure others are picking up the slack. So it is a team effort, because you're trying to you're dealing with health, you're dealing with people who want stuff now, so keeping that calm and allowing for the flow to happen is very important.
So another question for clarity, because we're talking about 16,000, a reach of 16,000 in Belize City.
That's for one primary care provider.
That's per one, and that's where I was going.
Yeah.
So that's for one. So if you say, so it's 16, how many primary care providers we have in Belize City?
5 basically.
5.
4 for the general population, and then the geriatric model mercy.
Okay.
So there are 5.
So you would times 5 by 16,000?
No, 4 mercies population is a bit
Okay, so you
smaller
times
because
4.
they're geriatric
You times
only.
4 by
Yes,
16,000.
that's the
That's the goal.
That's the goal. So, for example, one clinic like BMA Southside Clinic, you would be able to accept 16,000.
That's our aim.
So when you say you have space, you have a lot of space.
We have space in registration.
Okay.
Not
That's
physical
what I
space.
mean.
It's not
That's what I
physical
mean.
space. It's not that 16,000 people will sit in my room.
Clearly not.
16,000 will come one day.
And they will gradually age as well.
Yeah, right. So, but you have space for 16,000
For the registration process.
for the registration process. Now, in terms of funding these services, let's talk a bit about that. When I, as a NHI recipient, when I go, it almost sounds unreal. So I want to know, what do I have to pay? What's my side of the bargain?
To ask, you need your social security card, and you need to live in the area. That's the requirements, right? That card can be a valid card, or it can be an expired one, because you're accessing health services, right? No, the thing is though, but it's important, we mentioned that card, we must see your picture, we must see your name, and your date of birth. It can't be damaged, because people come with so card, you can't even see their face or numbers or that sort of thing. That's important. Then there's a co-payment. There's a co-payment, right? But it starts first at the clinic. I think you pay a $2 consultation. That,
$2.
yes, that offsets the water you drink and the toilet paper for the
Yeah,
bathroom.
and the AC
and
where
the,
you use.
yeah,
Yes.
AC and the leak
Imagine that,
painting and
$2 for all of that.
Yes.
The big thing.
And then when you get a referral to a lab, pharmacy and imaging, you pay 10%. But we have groups that are exempted. And these
Okay.
exemptions are the pregnant mother, children under 5, and the elderly 60 and over. All right?
Okay.
So, however, if somebody comes, they know their population, right? They know, and they know when somebody really cannot sometimes even afford the $2. They have the option to waiver.
Okay.
All
So
right?
it's 10%.
Yes.
10%
That's standard.
Standard, yes.
Standard.
What about persons that lived in the area in Southside Belize City, registered with NHI, but now they live outside of Belize City area, that area that they registered with? Can they still access this service?
They're still registered under the clinic.
They're
They're still registered under
and
the
they don't
clinic.
transfer because now there's options to transfer because
Okay.
we're expanding. But these people normally, even if they move, they won't give up that registration.
Yeah, I wanted to quickly get into now individuals that are accessing the service. Do you have high volumes of individuals accessing this service, and what has been their reactions and conversations? What has that been like with them?
We have been able to establish a very good system in regards to our hypertensive and diabetics. Each of my doctors have a certain appointment day, and in the mornings, so they could, and these are patients, hypertensive, diabetics, cardiac, they could have all three. And these are people who have appointment schedules that are monthly to bi-monthly. And so that morning you can run from 9 to 14. And these patients are directly just for that doctor in the morning, while the others are taking care of any acute or any other pending patients for results, etc. An average morning you can run from 16 to 20 patients in the morning. It all depends on the flow of the clinic. Besides the chronic clinic, of course, we also have a nurse that's available for the prenatal care, immunizations, that runs throughout the day for the clinic as well. And with going back to my chronics, our chronics are very fortunate that we even have an internist who comes in for those who have those are the patients that we're not getting as controlled as quickly as we liked and would need some time of specialist evaluation. So we do offer that service as well for the prenatals. If they're high risk, we have a gynae available for them as well.
Do you guys offer mental health services?
Unfortunately, at my clinic, I do not have any psychologists or PNP nurses. Those are available directly at the government clinic. So we use a referral system.
Okay.
So they get a referral system. So if we feel that there is a need, we contact directly, we make appointments for them, we give them the referral.
And then it would still apply with the NHI system where they wouldn't have to pay for
that
the...
would be
That would be different. That would be
Okay.
different. They would be going then into the government sector.
Okay.
And that's readily available for them there though.
And this is where we need to talk a bit about sustainability of the NHI program, because we can't go on forever being being funded by general revenue. That's fragile. So the new administration that came in has prioritized NHI, the expansion, also looking at sustainable funding options. So that is on the table. One of the things is basically from when they reinstate the Bolido and the and also taxes on sugar drinks and on healthy stuff, that money is filtered to NHI.
Right.
That it is designated, but that would have to be legislated, that those monies come to NHI for the program to be sustainable.
Yeah, because at the end of the day, NHI is not a for-profit system.
No.
And important to mention that from our budget, 95% basically goes to purchasing of services. Our administrative cost is only 5-6%.
Wow.
Very small. We have a small team. We've grown basically from 5-6 people to 12, and of course, as we expand, our team will increase. But that our budget is utilize, like what I said, the majority is for purchasing our services.
Speaking about expansion, let's talk a bit about, well, first of all, I'd like to say that I could see how this service benefits and truly changes the lives of families across Southside Belize City and across the country. I mean, if you are unable to afford quality health care and you have a quality health care service provider like BMA Southside Clinic in your community, and through NHI you're able to access those services that perhaps without NHI you wouldn't have been able to afford or wouldn't have been able to even step foot within that clinic, you could now do so through NHI. So I could see how this service is life-changing for many families.
And especially for the elderly population.
Especially.
You know, because I had my own experience when my mom was alive and my mom was homebound. Her medication, if I had to go over counter and buy, it would be like $300 a month. She got a monthly visit from Mercy because she was geriatric. She got her prescription. When she needed her labs, a lab tech could come home to take it.
Oh, wow.
You know, and in the case of the elderly, there's an exemption. So
Yeah, you're not paying anything.
with the productive age group, is like, I know if I go in and I do an ultrasound, that's 110, right?
Yeah.
So labs want $300. Now with NHI, if I have to do those same labs and imaging, my co-payment would be like $40.
Man, no.
Well, Paul, you see your reaction? That's the same reaction we get from patients. But patients need to understand that it's not
Free for all.
It's not free for all. It's
guided
It's
by
guided.
protocols
It's guided by
guidelines.
protocols as well.
Yeah.
You understand me? It's just that I did one in January. I need one in February. I need one in June.
Yeah.
There are guidelines for
Yeah.
those things because just as how you lit up, like that's really beneficial to me.
Yeah.
It is, but it's not to abuse it as well because I have people who come in who can't afford anything.
Yeah.
And I have families who have several ill, and I have to guide. So it's also looking at the patient as an entity. How often are we getting this? How necessary is it? I have patients who are on cancer treatment, chemo. They need more frequent labs. People with kidney disease, they need more frequent labs. How can I guide you and help you and say, okay, at this time, this is what we're aiming for. In 2 months, let's see what we need to do. But it's not just walk in and give me.
Now, I know that in speaking of expansion that there moves, or there has been a move to include a certain amount of police officers.
Yes.
Let's talk a bit about that decision and how that came to be.
It all started with an MOU between NHI, SSB, and the police force, right? And basically, we all know that the lifestyle in the sense of the job that policemen lead is quite unhealthy. They come in at maybe 150 pounds, but in a few years, then down there at 200,
Lot of stress, lot of fried
They
chicken.
eat terribly because
Of the
of
schedule.
the schedules
Yeah.
and that sort of
The
thing.
availability.
Yeah.
Also, what was like really, when you sit and watch the obituaries, there's always a police officer. It was like really something that was alarming. So that was what created that MOU and the commitment from NHI to support the police force. They, in turn, we would benefit by them helping us with safety and security on the south side. So maybe Doctora could talk about what is happening now at the implementation of this project.
Exactly. Due to their schedule, it's hard for them to come in. So what we've done is we took on the approach. We went into the precincts.
Oh, really?
So we provided a doctor and a nurse. They have a change of service, I think, somewhere between 6 and 7:30. And so we were there for the staff that's coming off and the staff that's coming in. So there was a doctor and nurse available to take your vitals, BP, your glucose. We had a doctor to address any quick questions, find out what, and she would give you a rundown of what's needed. When was your last testing? If they weren't registered, we were encouraging them to get registered or to go back to their clinic where they were registered with. So that became the approach of most clinics. Most of us addressed going to the precincts because getting them out is hard. So that was one. On another day, we went in, we gave health talks to their precinct, and we even took a nutritionist so that the nutritionist is available. Our clinic had even organized a specific day where there was appointment schedules. We created a WhatsApp group with the patients who are police officers and tell them, Friday I have a doctor available. Just for you all, make an appointment so that they could, we're trying to encourage them to come in because that's in itself is an
That
effort.
is a challenge.
Right.
I mean, getting off a 12-hour shift at 8, some people just want to go to bed. So to get them to come in and to take their health as a priority. And I mean, we do have a positive response. It's slow, but it's happening.
It's 500 police officers and 2 precincts. That's only 2 precincts. And that's 500 police officers. We need them to come in and access services. We have also integrated a physical activity program for them. We call a health wellness consultant has been contracted to do that, but we need to encourage them to participate as well in the physical activity because the police department has given 3 days, 3 hours a day for them to do that. So we need them to come because what I had touched base with the consultant and what she's saying, that the ones who come are the younger ones who are fit. And she wants everybody to come and say, please tell them I'm not kill Reina one day. And after that, I'm going slow with them at their pace. But that is the message we want the police officers to get, that then they need to take responsibility for their health. We're there to help them as well.
So Dr. Cuellar, you've been serving the Southside Belize city area for 10 years, you said. And this is an area that you also grew up around. We were watching some of the comments on our social media platform, and there's someone, Frankie Stain-Reyes, that says, love the service and one of the best doctors. She did so much for me and my daughter. My question to you is, when you hear responses like this, I want to know, is this how you imagine you'd be serving in the medical field?
No, actually, I was thinking of becoming like Dr. Stradaban in the beginning. That was my dream. But I will tell you, NHI, I worked at KHMH. I worked for KHMH 5 to 7 years. And I was in the NICU, and I was with babies. And seeing babies who had difficulty breathing, coming out, leaving with their mom, was a joyous experience and something that nobody could take away from you. But NHI has shown me another look. The quality, the range of patients that I've had, I feel like I've become a family doctor for some. I know from the time she was pregnant to now the baby's like, what, 10, 12? So I've seen families progress. I have seen my chronic patients improve so well that I've had people come off medication. That's your goal. I mean, I'm not operating you, I'm not taking out your, but I'm guiding you, I'm helping you to change your lifestyle, I'm trying to explain the best I can to you what could happen and the challenges in Belize with health. So if I'm able to capture you, because my idea is to manage, but you have to make the change. So if I'm able to get that message across, that's rewarding. And I've seen that, and I've seen people who are just genuinely grateful for that.
And to lead a team as well, that is a huge accomplishment on its own.
Thanks.
All right.
Be
Well,
commended.
yes, it definitely should be commended.
We have, I must say, that at all the other primary care providers in Southside, they all have head doctors, and patients do develop that rapport with them, you know. And I always tell them they fall in love with the doctor, and they only want that doctor. And sometimes a poor doctor overwhelmed.
You know, we've talked a bit about the expansion for police, but I want to talk a bit also about the expansion to Orange Walk, providing services to Orange Walk. This is a first in NHI, correct?
Yes. It's we launched last month, and the registration, we thought registration would take probably, meeting, because they also have a population target to meet, 12,000, 16,000 as well. And there are 3 primary care providers up in Orange Walk, Northern Medical Plaza, Clínica Nueva Esperanza, and La Asunción, those 3. And the initial 3 months is for registration, for you to register your members and then get your clinic set up, get your equipment, get your staff in place. And we're looking at registration yesterday, and these PCPs, they are registering people.
Yeah.
So come this month, we will get our support services. We're negotiating right now with labs and imaging, because once labs and imaging and pharmacy is put in place, then services can start. We're looking at October. I am saying that doors might be open for services already up in Orange Walk.
Is there an amount of finances allotted
Yes.
per patient?
Yes, it's a per member per month.
It's a per member per
And
month.
the government increased our budget this year so that we could implement the North.
Okay, but I would imagine there is flexibility. Is there in how that fund is used in terms of if I'm registered and there is an amount that's allotted per patient per month, and I'm just asking for clarification. But if I go in and if I don't go in this month, or if I don't use the entirety of what is allotted to me, that for somebody else who may need services that cost more than what is allotted to them, that there's some sort of flexibility there.
It's not so clear cut as that. It's a
Okay.
general budget.
Right.
It's a flat budget. You know your budget
Ah.
for the month.
Yeah.
And as doctors, we have to monitor that.
Okay.
So it's not because Paul comes in and Paul is only
Also
$5.
the
I'm only
tax
going
that
$5. No, it doesn't work
Ah,
that way. It
okay.
doesn't work that way. You are looked as an entity. You looked at what is necessary at this time. What can we offer at this time? It's not just.
I get it. Yeah,
And
I
it's
understand.
risk pooling in the sense that, remember, you're a chronic, so you might come every month. You're not chronic, and you want only to come when I gonna leave flu or I gonna leave diarrhea, something acute, right?
Yeah.
But we still encourage, because there's pre-diabetes, pre-hypertension, and if we can catch patients in that pre-phase, I mean, your outcome will be much better. So we do encourage people to come in and do
their
the
checkup.
annual checks, you know, check your pressure, check your sugar, so that we monitor people before they develop a chronic.
And that's what I was
disease.
thinking, because you guys are trying to reach 16,000 registrations, but that does not mean that you'll be meeting 16,000
No.
people. And I know that this really depends on what's taking place at the particular time, but what would you say is the most amount of people that you would be interacting with on a monthly basis?
On a monthly basis. I can tell you weekly I go over at least, we range for weekly up to 1,000 or more.
Wow.
Yeah.
Wow.
That's a lot of people.
That
Yeah.
is.
Yeah. I mean, I remember our
For
wait,
four
yeah, I
doctors.
remember on our
And
days
then
for
we have
COVID.
specialists too.
And then for COVID, there was days where you would see over 30 people for the day, and we would have to juggle. Yeah, so.
Yeah, I mean, it's like I like that you spoke about the risk grouping, in that it's similar to, well, it is insurance, but if you applied for vehicle insurance, for example, though I may not require a payout because I don't get into accidents, you have somebody else also paying into that insurance that may require a large sum of payout.
And that's the approach. That's
That's
the
the approach.
concept.
That's
our
And this is
concept.
why we need sustainability.
Indeed.
We need financing
Indeed.
options and mechanisms placed so that this would be for perpetuity. Because I have been with NHI for 22 years. I started just like Doctora and then went on to administration, you know. But what I have seen in 22 years, it's like the people who are not getting it really don't know what they're missing. The people who are getting it, we really
Love
can't
it.
take it away, you know. So I am, just the other day there was on Facebook, somebody, they were talking about the health system, and this person wrote about both her parents being 80 and 83 and how they had benefited from the NHI system. So she is hoping that this NHI program can go on to other levels, which with proper sustainability and financing mechanisms, we could have to tertiary. We could have mental health incorporated, dental health incorporated, but you need the finance to do that. Because we have had consultants from PAHO come in and actually worked with us in creating all these scenarios. You know, it's like we compare to food. Food is always a good comparison. You could get rice and beans for what, $12 now because you got enough, right? One rice and beans for $12. We could get one good boil up for maybe like 20, you know, and then you could get filet mignon. So filet mignon, the tertiary, right? That's when you get cat scan, all the,
I love the analogy.
yes. So they gave
People relate
us
to
the
food.
scenarios at each level and the packages of services and what it would cost. And you know, incredible, when you break it down to per person, per population, it's affordable, you know. It's like sometimes $350 per person a year. And we know when we go in for a consultation, we knock out $350 in a one sit down. And that is what you'd pay per member for your family for the year. So it's something that can happen. But of course, political will is important, and that is in place, commitment from government. And also responsibility, as citizen responsibility as well. And who can probably afford to pay, could pay for those who can't. We have to remember that the solidarity and in concept as well. And then we have a healthy society.
Knowing the affordability that NHI comes with and the way that it tries to serve the lesser income bracket communities, does it come with a stigma to be a part of NHI?
No.
Would you say?
No stigma. No stigma. People like that. I belong to a clinic. People like the idea I belong to a clinic. I have a doctor. I have a doctor I see. When I go, I ask for that doctor. They've established that relationship. And Dr. is talking about expansion, but the fact that we're at a primary care level and that we're working on lifestyle changes and encouraging people to be aware of what health could transport to and the complications. This is a goal right now to reach these people so that we don't have a population getting amputated and needing dialysis. Yes,
it's cheaper to keep people healthy
no.
at primary health care level.
Prevention is better.
Yes, that's the idea.
Yeah.
And getting people to capture that concept. Just pop in. You know, I haven't been here for a while. I want to know what you all have.
Important, sorry, doctor, is the screening.
Yes.
We do cancer screening for, doctor can tell you about that. I don't.
So exactly. So like I was saying, if you just pop in, you said, okay, what is offered for me as a female or as a male? I mean, as females, we try to get your pap smears, your mammograms. As males, we look for prostate cancer. You're looking also for, in general, for colon cancer. So these are all services that are discussed with the patient.
All right, excellent. Well, ladies, any last words that you'd like to input just before we close? I want to make sure that we cover everything.
Encourage people who've not registered to register, people living on the south side to register, people in Orange Walk to register. It's important that you get registered, and all you need is a social security card, be it valid or expired, that we can see your face, your number, and your date of birth. Doctora, the police, maybe she could try
I encourage the police officers to come in to follow up with their checkups.
Doctor said she won't kill them all at once. One by one.
Don't do that. Nor the physical activity consultant. She won't do that.
Well, I just want to say excellent work over at the Southside Belize City NHI Clinic. I know that you guys are expanding across the country. You also have several other clinics, so excellent work in all the other areas. And we hope that there's many more registrations to reach that 16,000.
Yes.
Thank you.
All right. Thank you so much for joining us.
Thank you.